Good afternoon, and thank you for the invitation to present at the Opus Forum. My name is Lyndon Hawke, and today I'm going to be talking about physical activity, particularly in the context of physical activity for health after joint replacement. And I hope to present some of the insights and findings I've gained so far on my PhD journey. As I have delved more into this topic, it became very apparent that everyone defines physical activity differently: what it is, what it feels like, how often it should be done, and the benefits associated with it. So I'm going to define physical activity as the World Health Organization does in their official statements, which is any bodily movement produced by skeletal muscles that requires energy expenditure. That definition basically covers any movement, great or small, short or sustained, but the reality is that not all physical activity, as it is defined, provides equal health benefits. Consequently, one of the ways physical activity is further defined is by intensity: low, moderate, and vigorous. An example of low intensity physical activity would be a casual walk. Moderate intensity physical activity feels like you're putting in some effort but can still hold a conversation. And vigorous intensity physical activity is activity that makes you breathe harder or puff and pant, like jogging. The World Health Organization recommends that adults do 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity physical activity per week for health benefits. So why the emphasis on physical activity? The fact is, physical activity matters. Doing the right type and amount of physical activity has been found to markedly reduce the risk of mortality, specifically from cardiovascular disease. Yet, despite the common knowledge and irrefutable evidence that physical activity significantly benefits people's health, compliance is problematic. In Australia, 45% of adults meet the physical activity recommendations. And that sets the scene for the real crux of this presentation. What relationship do people with joint replacement have with physical activity? For starters, people after joint replacement are far less likely to be involved in moderate or vigorous activity than the general population. One study estimates that 95% of people after a knee joint replacement fail to meet physical activity recommendations. And a recent systematic review found that people did not increase their physical activity levels up to 1 year after hip replacement. There is strong evidence that after joint replacement, people do not increase their moderate and vigorous intensity physical activity to levels seen in the general population, despite significant reduction in the symptoms caused by osteoarthritis. This means that after joint replacement, people remain at risk of early mortality and chronic disease, especially cardiovascular disease, due to low levels of physical activity. So the big question is, why don't people increase their physical activity levels after joint replacement when in most cases people's joint pain is significantly reduced and their function has improved? To find out, we conducted a qualitative study to explore how people after joint replacement perceived physical activity and what motivated them to be physically active. 22 semi-structured interviews were conducted with people 6 to 12 months after their joint replacement. Our main finding was that after knee joint replacement, people were generally in the dark about physical activity. And by this, I mean that people generally had limited understanding about a number of important aspects of physical activity. This included limited understanding of physical activity recommendations. Most people had never heard of them, and those that had didn't appropriately apply them. People struggled to understand the difference between low and moderate intensity physical activity. The participants confused being busy, like walking around the house, doing the dishes, doing the shopping, with moderate intensity physical activity. Consequently, participants frequently overestimated how much moderate intensity physical activity they were doing. Also, people had limited understanding of the health benefits of physical activity. In fact, the most common benefit listed by the participants was in the area of mental health, like feeling better about yourself, rather than cardiovascular or musculoskeletal health benefits. We also observed that people did not prioritise their new joint for physical activity that benefited their health. Instead, people's motivation for being physically active was to get back to doing stuff that was important to them. Overwhelmingly, this was doing things that restored social relationships, community engagement, achieved life goals, restored self-identity and independence. Things like going out for shopping and coffee with their daughters, going camping with a troop of cadets, taking care of a spouse who has a walking disability, a caravanning trip around Australia, and spending time at the beach with grandchildren. As great and as important as these activities are, from a strictly physical activity perspective, most of these are of low intensity, are not regular, and don't dramatically increase time spent in moderate intensity physical activity. Further to this, people perceived that their post-joint replacement rehabilitation did not explicitly address their physical activity levels. Instead, therapists focused more on overcoming knee impairment, like restoring joint range of movement, muscle strength, and overcoming activity limitations, like practicing going up and down stairs. Again, all very important and essential, but appeared to miss an opportunity to address low physical activity levels after joint replacement. Another main reason why people didn't increase their physical activity after joint replacement was that the focus of their osteoarthritic joint as a barrier to movement pivoted to other issues. So instead of their osteoarthritic knee that prevented them from being active, it was now their shoulder injury, back pain, or another medical issue. Social isolation, lack of motivation, and additional financial costs like paying to access a gym were also viewed as barriers to being more active. Some participants even said that because they had such a good result from their knee replacement, they were too busy doing the things like organising the household to participate in structured, moderate intensity physical activity. So what do we do with this information? This is where it's prudent to have a closer look at a theory that underpins behaviour change interventions, and that is adequate knowledge of a health behaviour is required before steps can be taken to change that behaviour. Quoting from Bandura, who put forward social cognitive theory, people who lack knowledge of a health behaviour have little reason to put themselves through the effort of changing their behaviour. Given the demonstrated limited knowledge of physical activity after joint replacement, perhaps we can put forward the hypothesis that increasing knowledge of physical activity after joint replacement is an important first step in laying the foundation so that the next steps of the behaviour change process to ultimately increase physical activity levels after joint replacement can take place. How do we most effectively increase knowledge of physical activity after joint replacement? This is yet to be investigated. We are currently looking at the possibility of involving people who have had a joint replacement to co-design an intervention that increases knowledge of physical activity after joint replacement. Stay tuned. But in the meantime, there are a number of things that we as health professionals can do to create an environment that may be more conducive to facilitating increased physical activity levels after joint replacement. Firstly, assume that people don't know the basics about physical activity. Assume that people will not automatically increase their physical activity after joint replacement. People who have been inactive for a long time are likely to stay that way even when their pain has decreased and their function has improved. Discuss the appropriate type, intensity, and dosage of physical activity with patients. Explain the health benefits of physical activity to patients, especially how it is protective against cardiovascular disease, some cancers, and dementia. Relate the benefits of physical activity to activities that are meaningful to patients. For example, how being more active will positively impact their role as grandparents, as gardeners, or walking the dog up that hill. Talking about moderate intensity physical activity during rehabilitation appeared to be particularly important as most participants felt rehabilitation was the best time to receive information on physical activity. Before surgery, when people were in pain, talking about it was deemed irrelevant, and too long after surgery may mean that low physical activity behaviours become established. Also, people wanted specific physical activity messaging. Talk about targets and goals, like going for a brisk walk for 30 minutes every day. And finally, a number of participants felt that it was important that all the health professionals, including their surgeons, other medical staff, nurses and therapists were consistent with their physical activity messages. So by putting into practice a few of these simple things, we as health professionals have the ability to lay the foundations to improve the physical activity levels and therefore the health outcomes of our joint replacement patients. Thank you.